Dr. Isunju, welcome.
Thank you, Josephine.
It really is a pleasure to have you here. Where are you from originally? I think I know, but I'd like to hear you say it.
Okay, I'm originally from Fort Portal, and can't call it a small town because now it's a tourism city, and that's where I grew up. I studied up at senior 6, and then moved to the city.
Right. How did you come to be working in the Institute of Public Health at Makerere?
Actually, I started there when it was an Institute of Public Health. Now it's a standalone school of Makerere University. It's been under the College of Health Sciences, but now it's a standalone school, more or less like a college. Yeah, that's why I studied my bachelor's of environmental health science, which really looks at how the environment affects health, in simple. And it's a branch of medicine which focuses on preventive. So largely public health focuses on prevention, but the real operational field is environmental health, because it's the one that looks at the safety of food, the safety of water, the safety of air, and everything else that could lead to ill health.
So maybe if you wouldn't mind, if you could just tell me what your work is. What are you involved in?
Okay, I do many things, but my core is working at the university, teaching, research, and community service. Those are the core mandates of Makerere University, so that's my primary job. But as you know, when you are a resource person and you are in an environment where you translate knowledge into practice, you need to have impact. And we get to have that impact by supporting programs, supporting policy, and innovating new things, new knowledge, contributing to development of operational guidelines. So for now, I've been, for the last, say, to nearly 20 years, I've been teaching at the School of Public Health. But I've been doing lots of other projects along the way. Many of those are in the line of disaster risk reduction. I don't know whether now I should take you to my studies, because that already rings a bell in the background. So after the environmental health, I did masters in integrated water resources management at the University of Dar es Salaam, because it wasn't in Uganda by then. That was in 2007 when I finished. And IWRM, or integrated water resources management, looks at water as a cross-cutting resource which is affected by actions by different stakeholders, and it's needed or demanded by different users. So because of that, you need to bring all these stakeholders on board if you're to make sustainable, equitable, and economic decisions on water. That introduced me, it basically helped to bridge the gap between integrated approaches and public health. So now I was having water as an integrated resource that we need to manage in an integrated way. And then later I came to pass on this knowledge at the School of Public Health, where we have courses that are very much aligned to that. There's one called hydrology and hydraulics. So I came back and started coordinating that course, hydrology and hydraulics. Now hydrology and hydraulics really looks at the water cycle. And it brings us to understand that water is a limited resource, because it can get exhausted from where you are. Much as it is matter, you can't really finish it. It will change into a form that you cannot access it. And therefore, it is important to judiciously manage it so that you don't lose it to the immediate, for the immediate need. And that means looking at water demand management to control the way people use the water so they are not wasting, to ensure that it's distributed equitably if it is water supply, not one user is exhausting it for every other members of the community.
So we've had an episode on this subject, on hydraulics before. Help me tie in the work that you've done, what you've studied and what you're currently doing with the subject of climate change. It's usually very easy for people to just say, he's from the environment department. What are we talking about with him on climate change? So help us understand how it all comes together.
So, what you want me to link is climate change and health, is that? Let me use one sentence, say that a healthy environment, healthy people. Okay? So let's look at the components in the environment that could be affected and make the environment unhealthy. When it dries up during long droughts, what happens to the soil? It becomes dusty, isn't it?
Mm-hmm.
And that means particles can rise up into the air and contaminate the air, increasing air pollution. And also the risk of wildfires increases, which also puts in more particles into the air, both the physical and the other particles, the nanoparticles that are coming from smoke or burnt, a myriad of chemicals that come out when you burn something, the hydrocarbons. So these contaminate the air and they actually affect the respiratory system, and some of these small particles can get sucked into the bloodstream through the lungs and they increase the risk of clotting. So that means you're going to have an elevated risk of heart diseases, because if the blood is thickened and has high risk of clotting, you're increasing the risk of hypertension and coronary heart disease, respiratory tract infections. Those particles can easily become a point of attachment for pathogenic organisms. So if there is high pollution, there would be an increased risk of TB, increased risk of all these other, and lots of people are allergic to different things in the air, to contaminated air. So you have increased risk of asthma, increased risk of bronchitis and others. So that's about air pollution, just one.
Before you move to the next one, you know, when we say these things, already there are climate change deniers, right? And it feels like it's very far-fetched to just tie everything to climate change. So now we are saying tuberculosis, we're saying high blood pressure, we're saying stroke, we're saying all of these can be tied there. Just help us believe you.
So now, maybe let me draw you back a bit about this concept of climate change. So climate change, by the time you say change, you must have a reference to change it from what to what and when. So if you're to get to say climate change, you need an average, at least a period of 30 years, 30 to 50 years. And that would force you to compare before the so-called period of 30 years and after that period. So that means if every time you're going to talk about change, climate change, you need to be referring before and after. And yet you may find that time you don't have enough data about everything that you want to measure.
So if we were to measure from 2005 to where we are now, do we have data?
The data is there, but it is very scanty and may not give you the parameters that you want. But there is something I wanted to clarify here. This change is sort of continuous. So you'll pick out in a 30-year period between maybe 1950s up to now, you can pick several. And that means even in the future, you can pick several of those. So that means the climate change is sort of continuous process. But should that be our concern? Our concern is the climate we are living in has exceeded threshold for safe environment. You see that? That should be the real concern. The real concern is that we are living in an era where the climate has changed to an extent that it's now becoming hazardous. The environment has lots of hazards that affect humans. In various ways, we can talk about how all those affect. And that is likely to worsen as we move forward because the change is only escalating. So, and most of the time now for climate, we talk of climate and health because we are talking about the current climate situation. Yeah? The current climate situation and what it's presenting to us and what we are predicting in the future and how we need to cope with the likely consequences that are to come in the future. So I think I was talking about how climate, how the
is impacting the health of the population.
Impacting the health. So let's look at something else. Let's look at nutrition. We know that micronutrients are from vegetables. Iron from these vegetables, greens, etc. Can you really grow those in drought? You can't. Most of our cereals are seasonal. They depend on rain-fed agriculture. So you plan when to plant millet. Okay? If you miss the season, the millet will not grow. Same with maize. Millet is our source of iron. And iron deficiency, you know what it means. It causes gout and all these other. So if you're not able to bring to the table balanced diet, you're going to have malnutrition. So climate change directly affects food security and therefore health. That's another way. The other one is water. You see my field really, I studied water supply, sanitation and wastewater management for the master. And water is life. Yeah? It's just to put it, because we are 95% water. In Australia, in Brisbane city, their national water motto is every drop counts, count every drop. You see, that's about water demand management, the one I talked about earlier. And water also has a social value or attachment. You see people going to Namugongo, to the Uganda Matters Shrine and picking water. It's not just for drinking. Water has its social value. It's used for baptism. There are lots of other cultural things they use for water. And it also has its social identity. Because you identify with, when I'm directing people and I don't know where Uganda is, I tell them on the northern shores of Lake Victoria, because it becomes now my point of reference. So it's home attachment. Yeah. So now when water has lost that, it's no longer available for use, in in a safe state, maybe it's polluted or it has reduced, that directly affects all these its uses. Why? Climate change increases the intensity of weather events. If it is a flood, it will be a more severe flood. In terms of the speed of the water, because it will be coming in a very high volume and rushing in a short time. So when we're talking of severity of a flood, you're looking at the speed at which the water is moving. You're looking at the depth of the water and the extent. And of course, you have to think about the frequency, how often that happens. So with the changed climate or the current state we are living, the risk of these extreme or severe floods is higher. There will likely be more. So you've heard of Nyamwamba. Nyamwamba had been
Notorious River Nyamwamba.
The notorious River Nyamwamba. It has been flooding since the 1950s after they changed its course during the operations at the mines. It used to have a natural path, and then that path was a bit altered to give way to the infrastructure developments that were happening. And then it started to retrace its path. And that's why it would come to flood the settlements. But that has been happening all through the 70s, the 80s. But now with the hitting of the threshold climate change, we have reached a time where the floods from Nyamwamba will be much more frequent. In fact, the frequency will increase. Reason being, more ice will be melting at the top of Mount Rwenzori, and that ice will displace huge amounts of water in the reservoir lakes, and that will come rushing down even if it's in the dry season. Let's talk about, I was talking about water and floods. There's contamination. When these floods happen, you saw when Kampala flooded.
When Kampala floods.
Yes,
Not
when
it flooded.
Kampala floods. Because why do I say when it flooded? Because nearly half of the city flooded. I at least for the years you've lived, I don't think you've ever experienced that. Even myself, I've never seen almost the entire city flood. I've seen the bypass get constructed. It has lasted, I don't know how many years now. It's coming to 20-something years. It has never flooded. This time it flooded. So, meaning that we are hitting thresholds that we've never experienced before.
You've given me critical examples. Have there been any changes related to health issues over time? Have some health conditions become more apparent or more geographically scattered?
Very much. You see, health depends, for you to pick health outcomes, you're either going to depend on hospital records, and that means those that have been reported in health facilities, or you're doing surveillance at sentinel sites or in the community, or you're doing research. One of the things that need to be done is do surveillance for climate affected or climate regulated diseases or health outcomes. We do not have sufficient data. And some of these are not directly, like for example, if a house collapses and you get injuries, these injuries will directly be reported. But if there is a flood and it provides breeding sites for mosquitoes, you're going to report malaria and dengue and others, but you're not picking data on the vectors that are responsible for picking the malaria and transmitting across. So they are also an intermediate factor or mediating factor for which we do not have the data. So there are lots of data gaps in between. And data means research, because if you're going to collect data, you need to do it in really a scientific way so that it's valid. And that means it now takes us to research that will inform decisions. Yeah. So there's need to research the entire causal chain and stopping and not stop at just looking at relationships. There is increased this, and therefore there is increased this. But what leads to that, and how can you then intervene? Because when you come to interventions, you have to look at specific target areas and indicators you're going to measure for the impact that you wanted to achieve. So there is need to identify, they call it the theory of change or whatever, but the causal mechanism, so that you're able to identify specific entry points which you can use to break the chain. I want to give an example. You see, we say that climate change has led to increase in vector-borne diseases like malaria, dengue, and others, because it increases geographical reach of breeding sites, boosts their resistance because of change in temperature, increases the rate at which they multiply, the rate of growth, but also because of the raised temperature, some areas that used to be cooler, like Kabale, where the mosquitoes do not bite at a certain temperature, can now bite. But also the mosquitoes have adapted to be able to bite at different conditions. Now, there is also importation of alien species, like Anopheles stephensii. That one used to be in India, and later it came to around the coast of East Africa, Somalia, and Ethiopia. But now it is in Uganda. And it bites during the day. It survives very well in urban areas, so you can no longer say the messages we are saying, cut bushes around the house. So there are no bushes, but you have the mosquitoes. Then the other intervention for controlling of malaria is close windows early. It bites during the day. So these are the things that we need to catch up with. So climate change has triggered lots of changes that have not been uncovered.
If I'm hearing you right, the mosquitoes have adapted, the people have not. And the messaging we are giving people to help them help themselves are from way back. Yeah. And they've not adapted the same way that these mosquitoes have adapted.
Exactly. I've just put it right in a simple way. So we are not coping. We are not adapting to the changes. And also we cannot just adapt to what we don't know. Like right now, we do not know whether this vector Anopheles stephensii is here. We do not have data on it.
We just know that the mosquito that's now biting us, the things we are saying are not working.
Yes, we see that. What we see is that the data is saying there's erratic cases of malaria in Kampala. They shoot very high to epidemic values, and then they go very low in some seasons. But what we see is that during soon after the rainy season, you see a peak. Yeah. And we do not know what is responsible for the residual malaria cases after interventions have been put in place, like distributing mosquito nets. So you do interventions which are written down as we have been doing and which are already in the program. But we can see residual malaria cases.
So our interventions are not as effective as they used to be.
There are gaps. So there are gaps which need further research to be able to identify what next needs to be done. Yes. So that's what we are saying, climate smart health programming. We have a component in the HNAP, the Health National Adaptation Plan. I think it is component 8. It's climate smart health programming. Means that whatever program we are coming, all these NGOs, they operate through programs, okay? So these programs have to be made climate smart. They have to be informed by facts, by causal mechanisms, and not blanket approaches. Because blanket approaches, yes, they may yield some results, but then you're going to spend a lot. But if you have targeted interventions, the WHO calls it high burden, high impact. So you target where the issue is. And then with your limited resources, because we'll never have enough resources, now with all these donor cuts, you are able to get the highest impact even if with limited resources. So we also need tools to guide us to do that. There's one tool we have been trying to get institutionalized. It's called the SunPath tool, trying to look at exposure to pathogens in the environment, especially that come from the fecal contamination. So we look at the food, we look at the drinking water, we look at surfaces, hands, and we see where is the highest contamination. Okay, where is the highest interaction or exposure with the people? And therefore, what can be done? So you may find that the highest interaction is basically maybe with the drinking water, and yes, the flood waters or the water in the drainage may be heavily contaminated, but people deliberately don't step in it. So it is high concentration, but it's not a highest risk because there is less exposure. And yet you find maybe people are drinking this water thinking it is safe, but it has some bit of contamination. The other research that we're not really doing is understanding the viruses and how they behave. In fact, yesterday there was a workshop by WHO.
World Health Organization.
Yeah, World Health Organization. And they are trying to build capacity on how to do surveillance of these infectious diseases through wastewater, through sampling wastewater. Normally, you sample drinking water and you see the levels of fecal contamination. You say, okay, there is risk or no risk. But you don't get that much detail of what actually is there. So I was still explaining about the floods and the contamination to water, and I was saying that when the floods happen, they flood out what has been contained. What we see in these pit latrines, and those are containment chambers. If you're talking in terms of the sanitation chain, you start with the collecting and then you contain. Once you contain it, then you can now safely transport it to the treatment plant. That's the sewage sludge, like in the pit latrines. So if the floods come and compromise the safe containment, they will open up and flood out everything that you have contained to ensure the communities are safe. That's what actually happened when Kampala flooded. So whatever was contained in these containment chambers got into people's bedrooms, mattresses, etc. And it has never been cleaned out. And this has continued now to infect people, be transmitted from one person to another. The chain of disease transmission. Why? If you just go to dig out it will lead you back to very many other root causes. I wouldn't want to go in those. Yeah, but it basically compromises safety of drinking water and, of course, water for other uses, compromising sanitation systems.
You know, I'm convinced every time I listen to someone that comes into the studio that if I had a huge chunk of money and I needed to put it into the Ugandan economy, it would be to do research. I listen to everybody say, we don't have enough information to actually tell us. We can guess, we can assume, but to actually point to something and say, this is the problem. Where would you put your money?
Where would I put my money? You have to, when you're working in an integrated way, you don't fund one thing. You'd rather fund bits of everything and you achieve something than funding one thing. Let me give you an example. If you only funded research, yes, you'll get to know. So we know. So what? We get to know,
At least we know.
but we can't do anything.
You know, the problem is that we don't know. So we are doing bits and bits of things without concrete information that helps us get concrete outcomes.
Let me give you another example. So for example, you put funds in generating the knowledge. So you get to know that this is going to happen, but you do not have the money or the idea on how to go about it. What to do.
Solve it.
Yeah, what to do. It's like when they tell you you have cancer. Okay? There are treatments maybe in other countries where they would maybe use some nuclear medicine and give you some bit of relief, much better than the other options. But if you don't know, you'll not know.
You keep living your life, and then one day you wake up dead.
You wake up dead. So that's the thing. So it's important to have to do strategic planning. There are always very many things to do. But out of those very many things to do, what can we strategically focus on in a particular period? And that's why departments or ministries have to have strategic plans or strategies. We are currently working with the Ministry of Health to develop environmental health strategy. So the strategy identifies key priority areas that will be the focus in the next 5 years, and then breaks down the costs and identifies the potential sources of financing for these and coordination and who will do what. So you deal with something manageable. I would certainly look at what is in Uganda's national development planning, because these documents have been carefully crafted, I must say. They have the building blocks. We just need to implement them.
Is there any implementation that we're doing? Are there any measures that we've adopted, or that, I don't want to say the ones that are recommended, because it just feels like the recommendation stays on paper. Is there anything that we are doing right now to enable us to better adapt?
Yes. I will give you one example. Early warning is ongoing. The Ministry of Health and the Ministry, the UNIMA, Uganda Meteorological Authority, are working together through his project, I think, that is trying to improve data availability, the health data availability, and it is trying to integrate climate data with health data. Because you can easily model and predict
environmental data because you'll be having a lot of historical data and you can predict the weather data. Now, if you know the relationship between the weather data and certain health outcomes, that means you can easily predict the health outcomes and therefore plan accordingly or put measures in place. There is increased digitalization. This helps us to store all this information, but also increased integration, sharing of the information. I think what needs to be added is the action. So if we have seen this and this and this, so what am I supposed to do as the common man? I think that part is still missing. I've seen in the Netherlands, they tell you, okay, it is likely to, they have very many weather in a day. So they can have 5 different. So they'll tell you, make sure to carry an umbrella, a warm jacket. So you know that maybe around 2, I'll need an umbrella if I'm going to step out. So you can now plan it in your day. Around 2, I will be indoors, so I don't really need an umbrella.
We had those updates, but we knew that if they said don't carry an umbrella, we would carry it because we just weren't sure about the accuracy of that message.
Yes, unfortunately, for us here, we largely depend on global models. We do not have very many stations. So these global models have to be also ground truthed so that the calibration can be accurate, so that you get much closer to the real scenario. But maybe we'll get there with time as we get our own satellites. And
what keeps ringing in my mind is you saying the mosquitoes have adapted and our messaging remains the same. Isn't there something to be said about that? If we know that it's no longer business as usual, that mosquito nets are not the overall answer, or that just making sure you don't have, or you close your windows at 6 p.m. If we know that that's not effective, why are we not changing the messages we're giving people? It's the same way on one of our earlier episodes, we were speaking to an extension worker who said, and another lady who said, her mother has grown up knowing that when she's told that don't plant in this season, she will plant because she knows that it's whatever the weather is going to be, it's going to be against what she has been told it is. So we don't trust our messaging. It has not evolved.
Yeah, I don't know whether that's my question to answer or the maybe it needs to be channeled to the right.
As a doctor,
yes.
Isn't there something to be said about the messages we're giving people?
It's very important to be calculative what you communicate, because you can either incite a reaction which you can't control. So communicating to society or to the public has to always be
calculated,
balanced and calculated. You have to, and also you need to communicate accurately. Most of the time you do not have full facts. So it's important to tell people that, yes, the environment has changed and it's bringing us more challenges. The government is coping to address these challenges, but in the meantime, be on the alert. Those kind of messaging, which keeps, of course, the government safe and doesn't incite much as research goes on. Because honestly, what do you want, like the Commissioner Health Promotion, to come and say if they do not have full detail of what they should say?
The problem is, if you're telling me that if I have a mosquito net, if I close my windows early, if I, get rid of all the open water sources that and I do all that, and my kids are still getting malaria, I'm going to think, and then later I find out, from conversations like this, I find out that, my friend, the kind of mosquito we're dealing with is not the one that I will just say, Ugandan things.
So you see, what happens is that in that case,
the ministry itself, once it has its data about what the new threat they have to deal with, then they have their emergency response teams where they sit and develop standard operating procedures on how they are going to address. You remember when Mpox came, it was a new thing. But my friend, immediately they had come up with messaging and precautions for the public. And they have a full department, a Department of Health Promotion, I think, which does all these communication messages. They discuss, they even agree on which images they should put out there.
I really don't like that picture on the posters.
Yeah, maybe they need to engage a little more of the stakeholders out there for their impression. I think that's a very good feedback. They need to check whether this is
It is an effective picture. It's just, yeah.
So the reason that they choose certain images or certain approaches, but also you need to know which kind of population you're dealing with. Maybe they can be, if you're targeting the youth, for example, they may not be reading posters. They need large on social media, TikTok and what. So you need TikTokers to come and do a message that is going to capture that audience.
What more does the government need to do in terms of research and spending? And we spoke a little bit about this in the area of climate change and health. What should be our priorities?
Our priorities should be financing, because the actions are there.
Financing what?
Financing the actions, because you see, in the framework that we are following, the United Nations climate, UN climate change convention, framework convention, UNFCCC, UNFCCC, framework convention for climate change. It's like two-pronged. So you have to go adaptation or mitigation. Yeah. And for Uganda, being that we are a developing world, if we go into mitigation fully fledged, we will close business. That means we can no longer move because our vehicles will be polluting. We can no longer have our factories operate because they are polluting. So meaning the country will hardly develop. Yeah.
So adaptation.
So our priority would have to be adaptation, coping, and finding ways to survive in the midst of the changing environment. So adaptation, the framework of adaptation follows developing sector-specific adaptation plans, which together inform the national adaptation plan. And out of that, the country will pick strategic actions to do,
which I think are already part of the national
development planning, NDP4, NDP, even the other previous ones. For the health sector, we have already developed the Health National Adaptation Plan. In fact, Uganda was among the second country globally that was able to pull off the National Development Plan according to the guidance that was provided by the United Nations and WHO. So in that we have 10 areas of focus. So those are the 10 areas that I was saying we need to finance. The 10th is health finance, climate and health financing. So the financing is to finance the coordination, which is the first one, leadership and governance and coordination, because climate change is a multifaceted. Everyone has something to do. If you need infrastructure and you're a department of environmental health, in Ministry of Health, you're not the one who puts up infrastructure. You have to go to the Department of Infrastructure. You have to talk to the Ministry of Works, and so on and so forth. Energy, you need sustainable energy. You need to work with the Ministry of Energy, because sustainable energy is a critical component for healthcare. Otherwise, you'll not be able to keep the cold chain in healthcare facilities. You'll not be able to sustain all the other services, lighting in the hospital, delivering mothers at night without energy.
It all ties in together.
Exactly. You can't
Not provide clean water without energy. So these nexus, interconnections, you need proper coordination. And that's why the Prime Minister's office is always a center point in these meetings. To implement the Health National Adaptation Plan, a small task force was set up to coordinate the other actors. And it includes someone from the Prime Minister's office, someone from the Ministry of Finance, because they are in charge of climate financing. And out of that, we need to pick out the climate financing for health programming. We have to bring on board all the CSOs, the NGOs, so that
their health programming is going to pick components from each of the 10. If, for example, AMREF has some funds for research in health, it would prioritize research in climate-related health issues.
Your response then for priority is funding.
Yes.
We need more money.
We need more money because we have the plan.
And you hinted on this, you lowered your voice a notch lower when you were speaking about the withdrawal of funds or, the changes in the donor sector. But I'm going to ask you this question anyway. What major consequences on your work and on that of your colleagues in the field of health have you seen with the recent withdrawal of funds by the US government?
Yeah, you see, everything that has been happening has somehow been linked to donor funding, even government programs. My personal research, of course, had applied to NIH and other things, and all of a sudden,
NIH?
our National Institute of NIH of Health in the US, it funds health-related research. National Institute of Health. So somehow it disappeared. We didn't even get the feedback. We had a partnership with several other universities, including Johns Hopkins. But somehow everything went silent because they could not communicate clearly on what next. And unfortunately, what happened with the US is being replicated in other countries. You see the UK being a little tight on the funds. CEDA pulled out. You see Norwegians are also pulling out. Everyone is sort of centralizing, and then the war threats. The Europe was trying to cut budgets and prioritize security. So it's affecting, and the problem is that it is being replicated across. That, of course, whenever there is a challenge, it sends you thinking of the solution. Yes, I see it is bad, but maybe it is eventually going to trigger us to be more sustainable, because now COVID taught us that you can actually survive when the entire world is shut down. We can still survive, and for years. So I think it is time to think of new ways of how to go about it. cut expenditure, prioritize, be more keen to look out for leakages where resources have been leaking, and be able to consolidate the limited meager resources to focus on priorities, even to think deeper for high burden, high impact. Like I told you, to be able to say if we invested this, what will be the return on investment versus the other, instead of going blanket and sometimes do a lot of duplication in programs. Yeah.
Have we seen any, and I like what you're saying about us being sustainable on our own. Have we seen any development organizations coming to fill in the gap from the cuts from the US government?
Even before the cuts, the government of Uganda had already realized that we cannot entirely rely on donor-driven funding, which are not necessarily informed by our local priorities. And based on that, they were funding research and innovations fund at Makerere University. And the condition for getting that fund is that the study or whatever research you were doing should be addressing national priorities. And they should align to the national development planning. And you must demonstrate how that leads. I think the other condition is that you need to show how the ordinary Ugandan is benefiting, impact in society. And I think that needs to even to be more emphasized. So that effort has continued. We see that the government, yes, is squeezed, but has continued to support that line of research. But also, I see that the government believes in the common man being able to do something, however small, which will lead to collectively will become bigger, which is the same understanding I would take. This parish development model is trying to empower people on the grassroots. Even if you're keeping one goat, that one goat will multiply. But if we wait to make ranches like it is in the Netherlands, that means you would have to shift all the people from the villages and then be able to do commercial large farms, which is not feasible in our context. So we must evolve organically from within. From within our current situation, how can we evolve organically and get to where we want to get? So I believe that collective action eventually achieves the desired. If well guided, you see production of coffee, for example. Our biggest issue is really the socioeconomic status of our people. If coffee can be streamlined and the market is streamlined and the farmers guided very well, it means that every little parcel of land, however small, will be having coffee that is well planted. And if the markets are also streamlined, it's now like it will be equal to doing one large farm of coffee if everyone is doing their part. But in this case, you're not now putting in labor yourself. It's the households. So I still feel like the government is trying, but also there are lots of challenges that are inherent, which I didn't want to dig into. During my PhD, I was looking at what has actually led to the situation in the urban settings, because I was looking at encroachment on wetlands, and which are very critical in moderating climate in the era of climate change. And I was looking at the current challenges people are facing who are living in these wetland areas. They show flooding, lots of mosquitoes, contaminated water, and all kinds of issues. But then those are just symptoms. So the next question is, why are they here? So the reasons why they are there, it is cheaper accommodation. The deeper you are in the wetland, the more the house floods during the wet season, the cheaper it will be, and the more it will be available. So if you're looking for a house to rent, that one will always be there. No one will tell you that it's floods until you find your TV or whatever is flooded. So it is cheaper to live there and walk to whatever industrial area you're working in town. So it is cheaper. They have valid reasons. So their socioeconomic status is driving them to live there. Unless you change it, they will live there. And when you're chasing them, when you're demolishing, you're not thinking what led them to be there. So if you're going to redeem the environmental resource or marginal areas, you need also to redeem the the empowerment of the community. Then the land, of course, the land parceling and the land ownership systems that we have in Uganda, which were set long ago without taking care of all the social classes. So the ordinary person who migrates from the rural area and comes into the urban was not thought about that time in the 1900 when they were doing land distribution, because that time was institutional land, kavaka, and the business land. So whoever was coming in the city to work for these institutions and rich people and sweep roads was not planned for where to stay. So they are the ones that started to build the slums in the wetlands. And when they come from the rural areas, the only thing they will do is they know is agriculture. You plant, maybe now you're in the urban, you can sell. So you go the open land in the plant sugarcane, plant yams and sell. There are buyers, so the life goes on. So the wetlands will be destroyed by all means, because the only thing people know is plant something and sell. And the only free land available is the wetland. Yeah.
We've gone into other areas that are of specific interest for me. But as we close this episode of this podcast, JB, what would be your parting shot? What would you like people to know about climate change and health, and what our priorities are as Ugandans or should be?
Okay. Yeah, so I usually say that everyone is a champion. Everyone is a climate and health champion because everyone is affected. Usually to a common man, climate change is far-fetched. It looks to be a very global thing. You need to narrow down to how the climate affects them on their daily activities. So if you ask someone, maybe in Pader, what they're facing, they will just tell you their well has dried, and now they walk a very long distance to get water. So their reality of climate change is in terms of access to safe water. Another one, who's a farmer, will definitely tell you the cows now are dying, and like in Toroko area where they had to lose so many cows. So we need to narrow down to the common man. Look at what they are doing. In fact, I like that project that you're doing, which is looking at livelihoods in communities. May I believe once we empower people's livelihoods, everything will thrive, because somehow everything rotates and comes back to socioeconomic. That pillar of human capital and socioeconomic transformation is very well thought. So if we can aim to build that, people will have the capacity to do all other small things themselves. Like, you very well know that there are mosquitoes, but your house is not very well screened. Why you can't screen your house is because your pocket is weak. It is divided between school fees, sickness, and all these other things. If this pocket was firm, and then you know what to do from the communication that is going on, and even you're guided on how to do it, then you will protect yourself.
Knowledge.
Yes.
Yes, well.
So knowledge and socioeconomic empowerment will change a lot.
Thank you so much.
Thank you.